Good afternoon, and the first item of business today is portfolio questions. Question 1, John Park, has not been lodged, and the member has provided no explanation or apology, and therefore we are displeased. Question 2 was not lodged, in fact was withdrawn for understandable reasons. Question 3 was not lodged and for understandable reasons. Now call question 4 in the name of George Adam.
To ask the Scottish Government what research it has conducted on whether there is a relationship between obesity and mental health.
Minister Michael Matheson.
There is a well-established association between obesity and mental health problems, which is supported by a body of research. While the Scottish Government has not added directly to that work, we have acknowledged the importance of the link, most recently in the new mental health strategy published in August this year, where we have given a commitment to work with NHS boards and other partners to support a range of measures that will help to improve people with severe and enduring mental health problems to improve their physical ability levels.
Mr. Adam.
Thank the Minister for his answer. The Minister seems to be aware of the research conducted by SAMH, Scottish Association for Mental Health, showing that people with mental health problems are more likely to be less active and concerned about being judged when going out of their home. Would the Minister agree with me that Renfrewshire Mental Health Arts and Film Festival, being held in the first 3 weeks of October, is one way to engage with those with mental health issues, not only in getting involved within the community, but also giving them confidence, if needed, just to attend public events?
Minister.
Yes, I agree with the member. Engaging in the arts, whether it be through participation or actually as appreciation, is a very positive way for someone to be helped in supporting the recovery from mental illness. The Scottish Government provide funding to the Mental Health Foundation to help to support the Scottish Mental Health Arts and Film Festival, which is one of Scotland's most diverse cultural events, covering everything from music, film and the visual arts to theatre, dance and literature. And this annual festival is about to start in October and takes place at venues throughout the country, which I would encourage members to consider participating in and attending some of these events.
Thank you very much. Question 5, Bob Doris.
To ask the Scottish Government how it supports people living with epilepsy.
Mr. Michael Matheson.
The Scottish Government is committed to ensuring that people with neurological conditions, including epilepsy, can access safe, effective and person-centred care. We are therefore working with NHS boards, the third sector and patients to make sure that the clinical standards for neurological conditions are implemented. We have already supported NHS boards to improve local neurological services by providing £1.2 million of funding over the last 2 years. NHS boards have demonstrated a real desire and commitment to continue with local service improvement. We want to see NHS boards to continue this work in working in partnership with the voluntary sector to build on the progress already made. We have therefore provided the Neurological Alliances of Scotland with funding of £40,000 to establish a national advisory group which will oversee and support NHS boards to take forward the improvements they plan.
Thank you. Mr. Doris.
Thank the Minister for that answer. And can I draw his attention to an initiative that I have helped secure in Glasgow to raise awareness of epilepsy within those working in the licensed trade. Epilepsy Scotland will now deliver training to all staff employed in Oranmore licensed premises in Glasgow and other outlets run by the proprietor Colin Beattie. Will the Minister meet with me and Epilepsy Scotland to discuss how this innovative approach to epilepsy awareness and training can be rolled out across not just to licensed premises across Scotland, but to other areas including justice and education, so that those who will have to deal with people they may encounter who suffer from epileptic episodes can make informed choices in supporting them in the best way they can?
Minister.
It sounds a very worthwhile initiative to me, and I'd be more than happy to meet with the member and with Epilepsy Scotland and any of the other parties who would like to explore this particular project. Further, I do think it's important that we ensure that various strands of government policy are working in a coordinated fashion across health, justice and education. And this strikes me as an example of where we can take that forward, and I'd be more than happy to explore as to what further work could be done to try and encourage this type of initiative to be rolled out in other parts of the country.
Thank you. Question 6, Liz Smith.
To ask the Scottish Government what assessment it has made of emergency surgery provision for rural communities.
Cabinet Secretary Alec Neil.
Presiding Officer, it is a matter for NHS boards to plan and provide such services to meet the assessed needs of their own resident populations.
Liz Smith.
To the Cabinet Secretary for that answer. He will be aware that in Perth Royal Infirmary it's seen a loss of emergency service provision over weekends, with no operations now taking place between 6 p.m. on a Friday and 8 a.m. on a Monday. Given that Perth Royal Infirmary serves a very large rural area, there's obviously growing concern that more and more services are being centralised to Ninewells in Dundee, with the relevant travel involved in that. The SNP has made a very specific commitment that rural medical care will not be diminished. So will the Cabinet Secretary give an assurance that we will not see any further loss of services at Perth Royal Infirmary?
Cabinet Secretary.
Presiding Officer, I certainly haven't received any proposals for any reduction in service at Perth Royal Infirmary, and I'm very, very acutely aware of the particular needs of all our rural areas in respect of all aspects of the health service.
Thank you. Question 7, Roderick Campbell.
What steps it is taking to promote the safe and effective prescription of psychotropic medication to care home residents?
If you heard the question, Mr Neil. If not, would you repeat the question, please, Mr Campbell?
To ask the Scottish Government what steps it is taking to promote the safe and effective prescription of psychotropic medication to care home residents.
Cabinet Secretary.
Thank you, Presiding Officer. I'd actually read the question in the bulletin this morning. We made a commitment to the National Dementia Strategy to reduce inappropriate prescribing of psychoactive medication to people with dementia. As part of this work, we commissioned research into prescribing, which has shown that since 2009 there has been a decline in the initiation of new antipsychotics and overall a decreasing trend in antipsychotic use. The number of older people with dementia being prescribed an antipsychotic in the first quarter of 2011 was the lowest level over the entire 2001 to 11 study period. The review of NHS pharmaceutical care of patients in the community in Scotland is considering evidence on the specific pharmaceutical care service needs of residents in care homes and how best these should be met, with a particular emphasis on the clinical role of pharmacists. This is an external review involving a wide range of stakeholders, including patients and patient groups, clinicians, the National Health Service, social care and voluntary organisations. The review will report to the Scottish Government in November, and we will decide then what action to take.
Thank you, Cabinet Secretary. And of course, you will know that it is important for members of the public and the OR to hear the question as well. Mr Campbell, please.
I thank the Cabinet Secretary for his answer. I wonder if the Cabinet Secretary has also considered the recommendation by researchers at the University of Dundee and NHS Fife for systematic medication reviews, particularly bearing in mind that the study found that the majority of psychotropic drugs used by nursing home residents were started prior to the patient being admitted.
Presiding Officer, all these recommendations will be considered as part of the review that I mentioned in the answer to the first question.
Thank you. Richard Simpson.
Yes, can I thank the Cabinet Secretary for giving us the information which he has, but given the fact that it remains that those in care homes with dementia are very significantly more likely to be on a psychoactive substance, would he consider, even before he receives that report, allowing those citizens who are in care homes to register with a pharmacist for chronic condition prescribing, which up till now they have been barred from doing? That is a right for every other citizen, and it appears to me that that should be a right which those who are resident in care homes should have as well.
Cabinet Secretary.
Presiding Officer, I'm always willing to listen to constructive suggestions from whichever part of the chamber they come from, and I certainly will take that matter into consideration in deciding policy for the future.
Thank you. Margaret MacDonald.
Thank you, Presiding Officer. Can I endorse what's just been said by Dr Simpson and suggest to the Health Secretary that perhaps there's a prior step that could be taken to ensure the comfort and safety of such people in old people's homes, and that is the training and the registration of people who are who's going to be working with them.
Cabinet Secretary.
Presiding Officer, another very valid point and suggestion from Margaret MacDonald, and again, it's a matter I'm prepared to take back and consider.
Thank you very much. Question 8, Richard Lyle.
Thank you, Presiding Officer. To ask the Scottish Government what improvement plans it has for Monklands Hospital.
Cabinet Secretary.
Presiding Officer, both this Government and NHS Lanarkshire remain totally committed to the maintenance and development of Monklands Hospital. NHS Lanarkshire is progressing an initial agreement to develop options for what will be a very complex work with a construction capital value of £400 million to upgrade Monklands Hospital to meet current standards. The £15 million made available in the Board's capital plan for expenditure on Monklands over the 3-year period from 2010-11 to 2012-13 is being spent on projects prioritising backlog maintenance and statutory compliance to ensure the building not only remains safe and functional, but also that the investment is aligned to the clinical requirements of the site.
Mr Lyle.
Can I thank the Cabinet Secretary for his answer and wish him well in his new job as his former constituency chairman. Does the Cabinet Secretary agree with me that mental health services at Monklands Hospital should be improved?
Cabinet Secretary.
Presiding Officer, can I first of all thank Dick Lyle for his welcome to my new job. It is much appreciated. And can I say that I can advise the member that NHS Lanarkshire are looking at the future of mental health services throughout Lanarkshire, and I believe that they are revising their original proposal in terms of the mental health unit in Monklands with a view to retaining an acute mental health facility in Monklands Hospital.
Thank you. Margaret McCulloch.
Thank you, Presiding Officer. Thank you, Presiding Officer. Across the Chamber, we all welcome the much-needed investment in Monklands Hospital, but can I ask what plans are in place or have been in place to renovate the towers at Monklands, which are in extremely poor condition? Are these already in the plans that you've just mentioned?
Cabinet Secretary.
Presiding Officer, I'm very much aware of the towers and indeed other physical problems with Monklands, which of course was opened in the late 70s. And as I've just said, there is going to be a £400 million capital spend, and that will include modernising, or perhaps I'm not familiar yet with the final plans because they haven't been finally decided, but it may well involve the removal of the towers, still to be confirmed.
Many thanks. Question 9 has not been lodged for understandable reasons. Question 10, James Dornan.
To ask the Scottish Government what recent progress the Detect Cancer Early initiative has made.
Cabinet Secretary Annet Neil.
Presiding Officer, the Detect Cancer Early programme was launched in February and aims to improve cancer survival rates for people in Scotland to amongst the best in Europe, initially focusing on breast, lung and colorectal cancers. The social marketing priming campaign ran through February and March with the aim of tackling fear and negative attitudes towards cancer. The first of the tumour-specific campaigns was launched on the 4th of September to increase awareness of breast cancer symptoms. Early recognition and detection of cancer symptoms is key to the success of the programme. To support this, Healthcare Improvement Scotland is leading a review of the Scottish Primary Care Cancer Guidelines, commencing with breast, lung and colorectal cancer. We are working with NHS boards to model potential increases in demand to ensure adequate provision of diagnostic, screening and treatment capacity.
Thank you. Mr Dornan.
I thank the Cabinet Secretary for his answer. As he said, the ongoing advert campaign fronted by Elaine C. Smith gives information and advice for women on how to check for early symptoms of breast cancer. It's expected that this will lead to an upsurge in women recognising and acting upon these early signs and symptoms. Given that this will inevitably lead to more consultations with GP surgeries, are there any plans to offer a renewal or review of training for GPs to reinforce the importance of early detection of breast cancer and assist them in working with other health professionals, such as practice nurses, to detect early signs of breast cancer as soon as possible?
Cabinet Secretary.
Presiding Officer, every GP in Scotland has received supporting breast campaign literature and specific information on the current Scottish referral guidelines for breast cancer. that will raise awareness both of the campaign and of the symptoms and signs of breast cancer upon which they should act. We are working in partnership with the Scottish Cancer Coalition and Scottish Primary Care Cancer Group to develop a GP education programme. A parallel programme of work involves GPs in the review of the referral guidelines for breast cancer, and once completed, there will be an opportunity for further awareness raising with GPs based on the new guidance.
Many thanks. Malcolm Chisholm.
At a conference organised by Bowel Cancer UK 2 weeks ago, we heard of the great success of the bowel cancer screening programme, but can the Cabinet Secretary tell us of any proposals or plans to develop this programme, and can he also tell us of any action that the Scottish Government is taking to reduce some of the unacceptably long waits for colonoscopy?
Cabinet Secretary.
Specifically in relation to bowel cancer, one area that I'm particularly looking at is how quickly, once there is a suspicion of the possibility of bowel cancer, how quickly then from there on in the patient's journey is to establishing if there is cancer and how quickly it can be treated, because the bowel cancer screening programme has been enormously successful, although sometimes in some areas the rate of response, particularly from men of a certain age, could be improved, and that would improve even more the success of the programme.
Thank you. Nanette Milne.
Thank you. Given our ever-ageing population in Scotland and the importance of early detection, can the Cabinet Secretary tell us what steps he intends to take to raise awareness of the continuing risk of breast cancer amongst women over the age of 70, given that routine breast screening stops at 70 and that with increasing life expectancy, more cases of breast cancer in older women are likely to occur?
Cabinet Secretary.
Presiding Officer, as the member will be aware, we already have a range of programmes to make all women aware of the probability or possibility of breast cancer, but I take the point that Nanette Milne makes about that particular group, and it's an area we're looking at about what additional work can be done to make that group particularly aware about breast cancer.
Thank you. Question 11, David Torrance.
To ask the Scottish Government what recent progress has been made on achieving the heat target for accident and emergency treatment times.
Cabinet Secretary Alec Neil.
Presiding Officer, this Government continues to view the 4-hour accident and emergency standard as an important measure of the quality of care provided to patients. This is the only government in the UK that maintains a commitment to delivering and sustaining the challenging 4-hour accident and emergency standard that 98% of patients should be admitted, discharged or transferred within 4 hours of them arriving at an A&E department. The latest official figures for Scotland are that in June across Scotland, 95.1% of patients were admitted, discharged or transferred within 4 hours, and we continue to work with health boards to make progress to improve the quality of care provided to patients through this standard.
Mr Torrance.
I thank the Cabinet Secretary for his answer. Will the Cabinet Secretary congratulate NHS Fife on the dramatic improvements on waiting times for emergency treatment? New figures released show that during July and August 2012, NHS Fife has gone from being one of the worst performing health boards in Scotland in the last year to achieving a performance level targets where 98% for people waiting for treatment were seen in less than 4 hours.
Secretary.
Presiding Officer, even though these figures haven't been officially released, I believe they have appeared in a local newspaper, and therefore I feel free to comment upon them and to congratulate Fife Board on this excellent performance.
Here, Jackie Bailey.
Could I welcome the progress on the 4-hour waiting times targets in A&E and join in congratulating the staff on their achievements? But does the Cabinet Secretary share my concern that the number of patients waiting over 8 hours and over 12 hours for admission and treatment has in fact doubled? And can he advise the Chamber what he intends to do to address that?
Cabinet Secretary.
Presiding Officer, to put this in context, although it's extremely small numbers and a very small percentage in that category, we're taking action right across the board to ensure that that does not happen in future.
Margaret McCulloch.
Thank you, Presiding Officer. 2 weeks ago, the Cabinet Secretary suggested that, again, the rise in the longest waits in A&E was simply due to circumstances, in particular hospitals. Can I ask him on the situation at one of those hospitals and ask why he seems so sure that the persistence of a 12-hour wait at Hairmyres has nothing to do with the staffing situation in the NHS Lanarkshire that was left unresolved by the previous Health Secretary?
Cabinet Secretary.
Presiding Officer, we've undertaken a very detailed analysis in every case where this situation arises, and I've been advised that staffing shortages are not the reason for these delays. There are other reasons, and I'm happy to write to the member with some more details of our analysis. I do have to say, in all fairness, of course, had Labour's plans to close the accident and emergency unit at Monklands Hospital and indeed Ayr Hospital gone ahead, then waiting times at accident and emergency units, certainly in Lanarkshire and Ayrshire, would have been far, far higher than they are today.
Thank you. Question 12, Claire Adamson.
Thank you, Presiding Officer. To ask the Scottish Government how it ensures that older people receiving support in their own homes have regular access to community medical services.
Cabinet Secretary Alec Neil.
Presiding Officer, providing high-quality care and support for older people is a fundamental principle of social justice and is an important hallmark of a caring and compassionate society. Supporting and caring for older people is not just a health or social work responsibility. We all have a role to play, families, neighbours and communities, providers of services like housing, transport, leisure, community safety and others. Health boards are required to ensure that care provided to older people by GPs is consistent with their contractual requirements and GMC's good medical practice. Under the Quality and Outcomes Framework, or enhanced services elements of the GP contract, boards may also have specific pathways identified detailing care of the elderly, and these would be monitored as part of the contract review process.
Claire Adamson.
Thank the Cabinet Secretary for his answer. Does he agree that it's vital that elderly and housebound have full and continued access not just to assessment and to clinical medical services but also dental services and podiatry, and also a full range of routine checks and screening services which ensure appropriate prevention and early intervention can be planned for this group of patients? And can I ask what the Cabinet Secretary is doing to ensure that appropriate transport arrangements and the information regarding those arrangements are in place for this group of patients?
Cabinet Secretary.
Presiding Officer, I expect NHS boards to work with the Scottish Ambulance Service and the range of local, private, public and voluntary transport providers to ensure all patients have the support and information they might need to access transport. The Scottish Ambulance Service are currently taking forward an extensive patient transport improvement programme, including redesigning of their service so that patients, regardless of their age, undertake a patient needs assessment. This direct engagement between the patient and the ambulance service ensures that ambulance transport is consistently available to those patients who require assistance or medical support to get to and from their appointments. This also ensures the most appropriate method of transport and the level of care can be provided.
Thank you. Question 13, Chick Brodie.
To ask the Scottish Government how much NHS Ayrshire and Arran spent on drug prescriptions in the years 2011-2012. Cabinet
Secretary Alec Neil.
Presiding Officer, the cost to NHS Ayrshire and Arran of dispensing prescriptions in the community in the year 2011-12 was approximately £74.4 million. The cost of secondary and tertiary prescriptions in the same year was approximately £28.6 million.
Thank you. Mr Brodie.
Can I thank the Cabinet Secretary for his answer? One of the major contributors to the expenditure is repeat prescriptions, which in many cases result in the non-use of the drugs so prescribed. An estimate is that this may cost the particular health board in excess of £1.5 million per year, a sum which might be better spent elsewhere in the service, the same applying across health boards in Scotland. Will the Cabinet Secretary therefore initiate a full review across all GPs and health boards in Scotland and secure an organisation and process which will ensure that a more rigorous view of this practice by those involved in medicine prescription and distribution will result in a fundamental change, and that the process and actions adopted will be subject to a regular independent audit?
Cabinet Secretary.
Presiding Officer, we're already tackling this issue under our improving efficiency programmes, and I can tell the Chamber that our estimate is that if every health board in the country adopted the best practice of the best health board in relation to prescriptions, we have the potential to save at least £30 million a year from the drugs bill, and repeat prescriptions are a significant element of that potential saving. And I can assure the member I will be driving health boards the length and breadth of Scotland to get into the upper quartile of performance in relation to this area, save that £30 million so that that can then be redeployed and redirected inside the National Health Service to provide additional or better service provision in other areas.
Excellent. Jackie Bailey.
Can I associate myself with Chick Brodie's comments, because I think they're absolutely valid? But in 2011-12, the Scottish Government assumed a 5% increase in the volume of prescriptions and allocated an additional £57 million to health boards for that purpose. Firstly, can I ask the Cabinet Secretary, what increase did you allow for this year? And secondly, does he share my concern that NHS Greater Glasgow and Clyde have identified a substantial overspend in their prescribing budget for this year? And what will he do to ensure that that has no negative impact on patient care?
Cabinet Secretary.
In looking at this subject, Presiding Officer, it is probably the case that Lothian Health Board is the most proficient and efficient in terms of their ability to efficiently dispense drugs. And I would like to see Glasgow and Clyde and all the other health boards follow the example and use Lothian as the benchmark. And I think if we do that, we can make the kind of savings I've indicated, and then make sure everybody gets the drugs they require, but we minimise wastage and it frees up resource for investment elsewhere.
Many thanks. Question 14, John Pentland.
To ask the Scottish Government how it ensures that NHS boards have a consistent approach when making decisions regarding individual patient treatment requests.
Secretary Alec Neil.
Presiding Officer, NHS boards are expected to maintain an overview of the effectiveness of their local arrangements for the introduction of new medicines, including NHS board management of IPTRs. NH boards were reminded of the responsibilities in this regard in additional guidance for NHS boards published on the 13th of February this year, under cover of SGHD/CMO (2012)(1), which recognised the benefit of NHS boards meeting at least annually to share good practice in relation to IPTR management. The guidance reflects recommendations which emanated from a clinically led short-life working group to consider the safe and effective use of medicines in the National Health Service in Scotland. The Scottish Government will monitor progress in implementing its CEL guidance on the introduction of new medicines, which took effect on the 1st of April 2011.
Thank you. John Pentland.
Can I thank the Cabinet Secretary for that answer? I recognise that this is a problem that the Minister has inherited from his predecessor, but it seems to me that the Scottish Government is disengaged from this process. Written answers that I have received show that there is no monitoring or comparison of health board policies, no monitoring of decisions, no standardisation of panels or procedures for dealing with requests, no standardisation of training for panel members, and while there are supposed to be annual meetings between boards, there hasn't been one yet, and no date is set, and no details are available about the contact between staff in different health boards. This is a recipe for a postcode lottery. How does the Minister expect to ensure consistency when the Scottish Government is not even looking at these issues?
Cabinet Secretary.
Presiding Officer, we are looking at these issues. Once the Scottish Medicines Consortium approves a drug for use in Scotland, each health board then has 3 months to submit their strategy in terms of the criteria and so on for the usage of that medicine. It is the case that a number of health boards have not, within that 3-month period, submitted and agreed their strategy. It is an area where I do agree with the member in general terms, although I don't accept all the specific points he makes, but I do agree in general terms it's an area where we need to improve performance to ensure that every health board, in relation to every new drug introduced, meets the 3-month target, and that we get greater consistency across Scotland, and it's an issue that I am addressing as one of my priorities in the new position I now hold.
Thank you. Jackson Carnell.
In that spirit, Cabinet Secretary, with so many new potentially and spectacular life-saving treatments becoming available almost monthly by routine, does the Cabinet Secretary agree that the expectations of patients for IPTRs probably cannot be realised? And in those circumstances, might he agree to consider the Health and Sport Committee inquiry into access to new medicines? And would he be disposed, were I minded to write to him, to consider meeting with all parties in the Chamber to see whether there might not be a route forward that we could jointly agree to ensure that we do not squander the opportunity that is afforded to us to really tackle long life ailments that have bedevilled society for generations in a way which would allow rapid access to as many people as possible to new medicines?
Cabinet Secretary.
Presiding Officer, first of all, let me say I obviously will take into consideration reports from the Health and Sports Committee, not just on this subject, but indeed in every subject that they report upon that impacts on my portfolio. Secondly, I look forward to receiving more detailed observations from Jackson Carlaw, and I will take those seriously. And thirdly, yes, if there are areas of health policy in Scotland where we can get greater consensus across the Chamber, then I am more than willing to work with other parties to ensure that happens. I think the National Health Service is one of the great treasures we have in this country, and it's important for all of us to work together to improve the health service as best we can, and if we can move forward on a consensual basis, I would be the very first to sign up to such a consensus.
Okay. Margaret MacDonald.
Thank you very much, Presiding Officer. I wonder, in his deliberations, if the Health Secretary, in seeking to avoid postcode lottery and much more of an even playing field of policy amongst the health boards, has considered that we may have too many health boards in Scotland and we could do with fewer.
Cabinet Secretary.
Presiding Officer, there are 22 health boards in Scotland, plus many other bodies, the Mental Welfare Commission, the Inspectorate, the Health Council and others. And I do think, given the scarce resources that we are all facing because of the budget cuts that are going to go on for quite a number of years yet, plus the increasing demands that the health service faces, we should look at where we can streamline the organisation of the health service to release resources that can be better spent on the front line. And that's an area that I will be spending some attention on in my time, however short or long it may be, as the new Health Secretary.
Thank you. Question 15, Graham Day.
Thank you. To ask the Scottish Government when it last met representatives of the World Health Organisation.
Cabinet Secretary Alec Neil.
Presiding Officer, a representative of the Scottish Government met with Dr Shekhar Saxena, Director Mental Health and Substance Abuse, and Dr Matt Mugen, Programme Manager Mental Health of the World Health Organisation, from the 3rd to the 5th of September 2012. This meeting was part of the WHO consultation on the European Mental Health Strategy and the Global Mental Health Action Plan. The Scottish Government has provided expert support to the development of the European Mental Health Strategy.
Mr Day.
Thank you, and I thank the Cabinet Secretary for his answer. He may be aware that the World Health Organisation's International Agency for Research on Cancer has, in the last few months, classified diesel exhaust emissions as carcinogenic to humans, causing lung cancer and an increased risk of bladder cancer, with Dr Christopher Portier, the chairman of the IARC, stating that the scientific evidence is compelling. Can I ask how the Scottish Government views these findings and what steps it is taking to measure the impact of diesel emissions upon the health and well-being of Scotland's people?
Cabinet Secretary.
Well, Presiding Officer, right across government, whether it's a transport function or climate change or health, we do measure all these emissions because we've got to reach our climate change targets. And we will and do take into consideration all the primary and secondary research produced by the World Health Organization, which is a first-class international body. I think the points raised by Graham Day are extremely important. However, I would put this caveat on those comments, and that is, at the moment, regrettably, probably the measures required to deal directly with that problem touches on reserve matters rather than devolved responsibilities. Obviously, I hope within the next 4 years we'll rectify that deficiency by not having such a thing as reserve matters. Presiding Officer.
Thank you. Richard Simpson.
Cabinet Secretary was doing so well until that last comment. Presiding officer, could I ask if when his representatives met with the WHO individual, I wonder if they did discuss the question of drug deaths, which is a major problem for Scotland, and where our drug deaths are increasing, whereas in England they are decreasing, and indeed in France they've got them down by a considerable measure. So I wonder if there was any discussion about what best practice might be of assistance to us in tackling this really quite difficult problem that's been rising for the last 8 or 9 years.
Presiding officer, can I make 2 points? First of all, my understanding of the discussions with these officials was that it was very wide-ranging across a whole range of issues. But the second point is, I do recognise this particular problem of the, relatively speaking, higher rate of deaths. We believe that a major element, a major contributing factor to that is that the very high level of drug abuse, relatively speaking, a number of years ago, a generation ago, has meant that people who abused drugs in those times are now getting to an age where their body is such that they can no longer tolerate any further abuse, or indeed sometimes the challenges of modern living. And we're seeing, as a result of that, this spike in the number of drug-related deaths. We think that is a major contributing factor, and because of the historical nature of that analysis, it is very difficult to see how any intervention from us beyond and above what we're doing could dramatically influence those figures. Obviously, where we can, we will, but I do appreciate that it is a problem, but it's not necessarily one where there is an easy solution because of the historical context.
Thank you. Question 16, Rhoda Grant.
Thank you, Presiding Officer. To ask the Scottish Government what action it has taken to reduce waiting times for people who have been referred for psychological therapies.
The Minister, Michael Matheson.
The Scottish Government has established the HEAT target to deliver faster access to mental health services by delivering 18 weeks referral to treatment for psychological therapies from December 2014. We've already made improvements in service performance across Scotland since the HEAT target was set. We have published the Matrix, a guide to delivering evidence-based psychological therapies in Scotland on what treatments are effective for which condition. The Matrix also stresses that services must provide adequate supervision to staff delivering psychological interventions to ensure patient safety and the delivery of evidence-based care. Through NHS Education Scotland, we are working to assess and develop workforce capacity to ensure that a range of staff are equipped to deliver these therapies.
Rhoda Grant.
Will the Minister take specific action to target areas where waiting times for psychological therapies are higher, such as in the Highlands, where there's an estimated 300,000 people suffer from mental illness? Boards covering large geographical areas with sparse population need more staff time per patient to deliver those therapies, and I would ask, would he take this into account when setting health board budgets?
Minister.
Well, it's important to recognise that in order to improve access to psychological therapies, we are clear that the HEAT target is there to drive all boards, including NHS Highland, to make sure that they have processes and systems in place and data collection mechanisms in place to ensure that they are meeting this HEAT standard. And it's for local boards to respond to how they can best affect that within their own local area. I, of course, recognise that some of our boards that cover larger rural areas have particular circumstances around how they have to then develop services in order to meet that target. And I would expect NHS Highland to do that in their planning and implementation of their policy, in making sure that they're making progress in achieving the target by December 2014.
Thank you. Question 17, Hanzala Malik.
Good afternoon, Presiding Officer. To ask the Scottish Government what recent progress has been made with the preparations of 2014 Commonwealth Games.
Minister.
Progress with our preparations for 2004 Games continues to be excellent. The great success of Scottish athletes in the Olympics and the Paralympics has enthused our nation and raised our profile of the Games. There are now just 665 days to the Glasgow Games get underway. In most recent weeks, we have seen the introduction to the world of Clyde, the game's mascot. Although a thistle called Clyde may receive an interesting reception amongst the Firhill faithful, the announcement of 3 high-profile Games ambassadors and new sponsors announcing their support for the Games. Construction work on the Athletes' Village is on schedule, and we will shortly see the opening of one of the major new venues that will be used for the Games, the Commonwealth Arena and the Sir Chris Hoy Velodrome. I'm very confident, Presiding Officer, that Glasgow and Scotland will be ready for the Commonwealth Games in 2014, and the next Partner Progress Report will be published next month.
Hanzala Malik, briefly, please.
Thank you very much for that very full response. Many members, and I'm pleased to say, including no fewer than 37 SNP backbenchers, have expressed concerns about the work capability assessments for employment support allowance being carried out by ATOS and their role in denying ill and disabled people benefits. Given these legitimate concerns, does the Minister consider ATOS to be an appropriate sponsor for the 2014 Commonwealth Games?
Minister.
Well, I am aware of the concerns that many members will have over ATOS. I, as a constituency member, have raised concerns around their work assessment programme as well. I think it's important that we recognise that these are, to a large extent, matters for the organising committee in Glasgow. And no doubt members will seek to make representations to the organisation committee on areas where they do have concern. But I don't think we should distract ourselves from the fact that we are making very good progress in making sure that the arrangements for the 2014 Games are in place. And the thing that I think they will be remembered for more than anything is the friendly welcome that they're assured from the people of Glasgow and the people of Scotland.
Thank you. David Thompson, briefly and relevantly, please.
Will the Minister support proposals to have a 2014 Commonwealth Highland Games linked with the Commonwealth Games, which will not only boost Highland Games but will also promote all of Scotland as a great place to visit?
Minister.
Well, Presiding Officer, it's my understanding that the Commonwealth Games Federations do not allow or permit the staging of exhibit sports as part of the Commonwealth Games themselves. But clearly we have a very long tradition in Highland Games, and given that it's also the year of homecoming, I've got no doubt that various organisations will wish to look at the possibility of hosting a major Highland Game event around that particular year. I would encourage Dave Thompson and those parties who are interested in taking this initiative forward to work with all the agencies who can support it and assist it in trying to make a success in 2014.
Thank you. Pushing it to the limit there. But that